Thank you, Governor Susan, members of Parliament from Nakuru County, the CEO of SHA, Dr. Masi, the CEO of Digital Health Agency, the PS Medical Service, entire leadership of the health workforce in Nakuru County. For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the digital health transformation agenda, which are very, very important pillars in achieving universal healthcare coverage. Through Taifa Care, we want to ensure that every Kenyan can access healthcare without financial hardship. The integration of the Social Health Insurance Fund, the Primary Healthcare Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that's why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered households have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa Sha Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa Sha Pole Pole is a very progressive because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance you are told you want to pay weekly, monthly, or daily. And last night you could see in our system, there are Kenyans who went through that system and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you pay. If you don't pay that day, the next day you'll pay double, 20 shillings. In Nakuru, we have got 409 healthcare providers who are contracted with SHA. We only have 6 public facilities, but those we have found out are not really under the county. Maybe health centers in Egerton University, health centers in our prisons or in our security agents. As of today, we have paid 43.9 billion from SHIF and 5.6 billion from PhD fund. And let me make it very clear, and I have told the governor and the leadership here, the primary health care fund is free. Kenyans should walk to any facility, be it public, private, faith-based, in level 2 to level 4. You walk in, you walk out, you are treated. The government of Kenya, under the leadership of President William Ruto, pays for it. In fact, we have just told the governor to put posters in all those facilities saying, enter and exit. You should not pay. And we are telling Kenya, the parliamentarians are here. They have budgeted 13 billion for that fund, capitation. So if any Kenyan is charged for primary health care, that is an offense. It's a criminal offense. And Kenyans must report through our call center 147. But as of today, 5.6 billion has been paid from that fund. SHA is transforming our health facilities, and in Nakuru County alone, 1.27 billion in SHA claims have been disbursed. And as the governor said, the Nakuru PGH, our referral hospital, in terms of lodging claims, in terms of payment and system, is the best in the country. We need to clap for. And we have seen that the healthcare system in Nakuru is up and running. It is something that many other people should borrow from. Let me come to the National Equipment Support Program, because we want to make sure, this government wants to make sure, for universal healthcare to succeed, we must have drugs in every facility. For universal healthcare, Taifa care to succeed, we must have the right equipment in our health facilities. And in this program of the National Equipment Support Program, which is transforming access to care. And this equipment, let me make it very clear, it is not bought by the national government, it's not bought by the county government, it is bought by the suppliers, it is fee for service. They are the ones who will take care of those facilities, those equipment. The number of Kenyans who use that facility, SHA will reimburse those equipment owners. So there's no investment. And Governor, I am very happy to report that Nakuru County will in the next 2 weeks realize the impact of the National Equipment Support Program. The following equipment will be installed in the month of from the first week of August. In Annex Hospital, we are going to install a mammogram, dialysis machines, and orthopedic machines. In Bondeni Sub-County Hospital, a specialized laboratory service equipment will be installed. In Molo Sub-County Hospital, digital X-ray, CT scan, routine laboratory service equipment, and all others that are required, that are requested, will be installed. The same for Bahati, CT scan, and general theater services. For Karingate, they have all that, digital X-ray, Langalanga Sub-County, Subukia Sub-County, Olongroni Sub-County, Joro Sub-County, Maimayu Level 3. All these sub-county hospitals will receive the latest equipment. This intervention will bridge the critical gap and expand equitable. As we move forward, let us recognize that health is not just about systems. It's about trust, it's about dignity, and it's about community. And that's why the dignity of the patient is of paramount importance. Going forward, the patient is the boss, not the facility, not the healthcare worker, not the leadership. And that's why we have introduced, and this is very clear, we have introduced in the last 3 weeks something called bed capacity access code. No Kenyan, no health facility, be it public, private, faith-based, will be allowed to operate outside their bed capacity given to them by the regulator, who is here, Dr. Kariuki. When you apply for a license, you must say how many beds you need. If you said 50, you will admit 50 patients. No more Kenyans sleeping on the floor. No more Kenyans sharing beds. Kenyans who don't know each other, they have different ailments. And if you tell us, oh, they are Kenyans, we can't return them, from Nairobi, from my office, the office of the PS, from our people here, the digital CEO, the SHA CEO, we will call the governor. We have told her this morning, this is how the bed capacities are. All your hospitals have enough beds, empty. So before, what used to happen under the NHIF, let me tell the country, when Kenyans sleep on the floor, they used to charge NHIF for a bed. When Kenyans share one bed, they used to charge 3 beds. So it was Ukora na Wizi. So I have stood my ground. Next week or the other week, no pharmacy will dispense drugs without a qualified pharmacist. No drug will be dispensed to a Kenyan if that drug has not been approved by the pharmacy and the poison board regulator. This is part of the huge transformation health reforms we are bringing as a government under the able leadership of President Ruto. Finally, let me say that let today be not more than a celebration for us. Let it be a call to action, to dignity, to digitally enable every facility, to enroll every Kenyan, and ensure every shilling delivers better healthcare outcomes. Thank you, and God bless you, the good people of Nakuru, under the able leadership of Her Excellency Susan Kihika. You have a question?